Assistant of the Community Wealth Building Commission on 28th of February 2023. I've noted we have Councillor Allison present. Do we have Councillor Brown? Oh, I can see he's online. We have Councillors Chalmers, Cooper, Fagan and Robb with us. Apologies from Councillor Ross. Councillor Walker is present. And I have Clelenson joining online, Paul Manning present, and I think we've apologies from Suman Sengupta and Hisashi Kubayoma. Also apologies from Jan Gardner. We have Josephine Pravin-Kumar present and Elspeth Russell, Stephen Sweeney present and Thomas Adamson. Thank you, Chair.
Right, thank you. And we'll just we'll get started just now. Can I ask item 1, are there any declarations of interest? I've not been advised of any declarations of interest and I can't see any. So can we come to item 2, which is the minutes of the previous meeting? Can I ask if those minutes can be approved as a correct record? I'm not seeing anyone suggesting that they can't be. Yes, so we could agree them. Are there any issues arising from those that people wish to raise? Not seeing any hands. Okay, so we deal with item 2. Item 3 is a membership update, and I just want to advise that this is an item for noting, but I also want to welcome Josephine Pravin-Kumar to the meeting. It's her first meeting of the Commission, and she will be representing NHS Lanarkshire. She is their Director of Public Health and Health Policy and leads the Health Board's Public Health Directorate. And I have a bit of a biography of you, Josephine, and it's very impressive. But I think actually a number of us know you from the Community Planning Partnership and from other roles, and we're glad that you're able to join us on the Community Wealth Building Commission. So can we agree to note that particular item? And if that is the case, can I then come to item 4, which is on the NHS as an anchor organisation. And we have, I think, with us Elspeth Russell, who's going to speak to this item. So I'm just going to bring Elspeth in just now.
Thanks very much, Chair, and thank you for the opportunity to come and speak to you all about the work that we've been doing in NHS Lanarkshire. So I'll just take you through the paper. What I really want to describe is a programme of work that started approximately about 18 months ago in NHS Lanarkshire around us trying to take forward commitments as an anchor organisation. And what I'll look to describe is how this work has been taken forward within the context of NHS Lanarkshire's new healthcare strategy, Our Health Together. I particularly want to highlight to the Commission that in light of the current cost of living crisis, we have used the anchor framework, the overarching framework, to develop a cost of living delivery plan as well, which really sets out what we are looking to do as an organisation to try and mitigate the impact of the cost of living crisis. So some of this ties into our wider plan, and some of it is about us doing more than we initially thought in light of that particular crisis. What I'm asking the Commission to kind of consider is to really think about what the opportunities are for us as an organisation to work collaboratively with our other organisations locally to maximise that collective impact we have as anchor organisations. And there's a lot of that work already happening, but I think there's more that we could be doing in that kind of joint space. So just to give a description of what an anchor organisation is, and I'm sure everybody's very familiar with this, anchor organisations are big and locally rooted organisations like ourselves, local authorities, colleges, universities, and they're organisations who have a long history locally, employ many people, have a lot of resources, potentially a lot of local assets, and crucially deliver services for the common good. They're usually quite intrinsically related to the local community and particularly to well-being. And they're really quite pivotal to the concept of community wealth building because of the scale at which they operate. In recent years in the NHS, there's been a lot of interest in anchor organisations as a concept, and it's something we started to explore in NHS Lanarkshire as we were coming out of the pandemic, and we particularly linked with an organisation called the Health Foundation to support us to do that work. They've done a lot of work in England on anchor organisations and worked with various NHS partners down there, and we were keen to learn from that. So we held some sessions with our local board and with partners to look at what more we could be doing in that space as we came out of the pandemic, recognising that COVID had had a significant impact on health inequalities, and that we couldn't just come back from that as normal. We really needed to look at how we could really intentionally do things quite differently. So what we have done over the past year is we have taken a framework that was developed by the Joseph Rowntree Foundation. This has 5 pillars, and we have worked through a kind of baseline assessment using those pillars to try and establish where we are as an organisation across these different areas. So the 5 areas, as you'll see in the paper, are employer, procurer of services, what we're doing around environment and assets, particularly around how we're using our local assets to support local communities, what we do in terms of our service delivery, which is a key area for us, given the NHS is predominantly about frontline service delivery. What are the opportunities for us to intentionally do things differently in the way we design and deliver our services? And then crucially, and particularly important in the context of today's discussion, is about those corporate and civic behaviours. So how we very much work with our partners to take that anchor thinking forward in very much a collaborative way. So we have done that baseline assessment, as I've set out in the paper, and what's happened over just recent months is that the Scottish Government, who have had quite an interest in this work, have launched a Care and Wellbeing, National Care and Wellbeing Programme, part of which is including an anchor work stream, and there is an ambition by the Government to really support all health and social care providers to become very active as local anchor organisations. So we are anticipating within the next few months that there will be a framework that will come out to local areas, and we will be expected as part of our annual reporting to report on this framework. We had already done the baseline assessment that I've attached with the paper, which is the Joseph Rowntree one, and the national one we are anticipating that will come for Scotland will be very similar, but will very much be developed within that Scottish context, so will very much reflect what we would want to do in Scotland. And what we will look to do is transfer our baseline assessment over to the Scottish framework to make sure that we're working the same as all other boards. When we did the assessment locally, we did that by engaging a whole range of internal partners, a whole range of leads, and asking them to complete the assessment for us. We then held quite focused sessions with different departments. So, for example, our procurement lead or some of our HR and employment team around the employability actions. And we really drilled down with them about where we felt we were at the moment in terms of each of the areas, and then how we could move to the next level. So you'll see in the framework that there's a whole range of ambitions in there, and there's 4 levels for each of them. So what we looked to do was score ourselves as best we could with what evidence we had, and then we looked at what actions would we take to progress to the next level. So we do have a draft action plan that sets all of that out. It is a very long action plan, and we're keen with the new Scottish framework coming to try and streamline that a bit more, and as I've mentioned, very much work with the partners around it. Under 4.6 in the paper, I have set out some of the examples of the work that we've been taking forward, under each of the anchor pillars. I won't go through all of these, but I'll just pull out a few under each of the pillars to give you examples of work that we were doing. It's quite crucial to say here that some of this work has been developed over a number of years. This isn't all new work. I think what's different about it is we are bringing it all together under one place, one plan to be able to show that overall contribution that we're making as an organisation beyond that core service delivery that is, you know, is our kind of bread and butter. But it's also about looking at those particular areas where we have maybe been doing work for a number of years, and is there an opportunity to enhance some of that, particularly through working with partners. So under employer, one of the key things that we've been doing in the last couple of years with COVID is obviously really enhancing the work we've been doing to support our staff. That's been really critical throughout COVID, and it's something that we're really keen to continue to do. And we've built a staff health and wellbeing strategy on the back of some of the issues that emerged throughout COVID, and really trying to make sure that our staff are as well supported as they can be. Another key area as an employer is really enhancing the work that we do in terms of employability. So we have actually got an employability strategy that's hopefully going to get a draft strategy that's hopefully going to get signed off in the next few weeks. And we're really keen to be, and have already been, working with the councils and other partners to look at how we can do more. You know, we employ a lot of people, and there's real opportunities there for us to do more around employability, and particularly to target some of those employability opportunities to some of our most kind of at-risk and vulnerable groups. For our own staff, and this ties in with the cost of living action plan that I mentioned, for our own staff, it's also about how we can look at what actions we are doing intentionally to support particularly our own staff that are lower paid. So we're looking for taking forward a whole range of actions around making sure our own staff know how to get support, how to access benefits they might be entitled to, but also some of the different programmes that we have that I'm sure the council have as well, things like staff benefits and pensions. Is there more we can be doing to actively support our staff to uptake those opportunities? And also what career opportunities we offer for our lower paid staff, and can we really make sure that we're offering as much as possible to allow people to develop if that's something that they want to do, and that our terms and conditions are supportive of people being able to access employment opportunities with our organisation. Moving on to procurement, we were fortunate in being able to identify some funding to engage in the supplier development programme as an organisation. So I know that's something the councils have participated in, but it's not something NHS organisations traditionally have. So it's something that we have embraced, and we're really keen to build on, and again build on that partnership. And we do have a procurement strategy which got signed off about, I think, 6 months or so ago, and very much that procurement strategy is about how we can increase local spend and keep spend within the local Lanarkshire area as much as possible. In terms of our environment and assets, one of the key bits of work we've been taking forward over the last year is about developing a community benefits plan for the new hospital build, which is a huge new capital build for the local area. There's lots of opportunities within that, and it's how we maximise them through a community benefits plan, looking at how we can really task the contractor to really do more than build a new hospital, but very much invest in that local community through opportunities for employment and opportunities for benefiting the community in line with what the community would like to see. So very much trying to engage the local community in what the priorities are for them around that. And then also within that one is the move through the pandemic as well to offer more online appointments and digital appointments. And we've got a digital strategy that we're looking to build on that. And try and reduce the need for people to travel as far as possible, which will obviously contribute to that wider kind of climate change agenda as well. In terms of service delivery, there's been a couple of actions we've taken forward recently that are worthy of note. One is around trying to look to develop a public health intelligence hub across the community planning system, and that's work that Public Health are taking a lead on with partners, so that we really fully understand our data and look at how we can collaborate to bring together all the data, really rich data we have, both quantitative and qualitative, on our local communities to better understand and target our programmes of work. Crucially, one of the things we've been doing through our new strategy in terms of service delivery is embedding a quality impact assessment into all the work streams of the strategy. This was a real major achievement for us as an organisation to get this commitment as we were starting to build back from COVID. And it was about recognising as all the services started to recover their services. We didn't want them just to build back to their old models, but to really try and take a hard look at how they were delivering and where there are opportunities to target better. We have used an integrated equality impact assessment in NHS Lanarkshire for a couple of years that goes beyond the traditional equality characteristics and very much brings in poverty and disadvantage. So what we are tasking services and very much supporting services to do is to work through those assessments as they recover their services and develop new models of care, and really challenge themselves to think about the populations that they serve, what data and intelligence they have, what consultation they've done, and really try and build their services to be much more person-centred and in line with the needs of their communities. And that's something that we've got commitment to across the whole of the new strategy. As I mentioned, we've got a cost of living delivery plan, which is almost a subset of our anchor overall plan. And within that, one of the key actions that we're looking to do in terms of service delivery is what we call routine inquiry for financial wellbeing. So if you're presenting at our acute hospitals or any of our community services, we are really keen that our staff are asking you consistently about your financial wellbeing and offering you support to access financial support services through both the statutory and third sector if you require that. So we have some areas, particularly through the child poverty action plans, we have some areas like midwifery and health visiting where that's already very much embedded in how they operate, and we're now trying to spread that practice so that it becomes just part of what we do in terms of how we deliver our services, so that we make sure everybody gets the access to support for financial wellbeing. And then lastly, the actions that were taken forward very much within our kind of corporate and civic duties. And this is very much about how we are working in that collaborative space with both the councils, but also across into the Glasgow City region as well. So we have staff linking through the Glasgow City region work to look at opportunities there for how we can develop as anchors, as well as starting to think about how can we demonstrate return on investment and how do we monitor all our progress around this and how can we do some of that work collectively. So going forward, as I've mentioned, we are really looking to take forward this anchor plan and really drive it forward through the commitments that are being made within our new healthcare strategy that is currently being developed. And it is very much about trying to do things differently and not just seeing us as a treatment and care service, but really thinking about what our contribution can be in terms of reducing inequalities beyond that direct delivery of care. We are very cognisant of the need to be realistic in terms of where we are all at as statutory services at the moment, and the financial pressures we're all under, the significant workforce pressures we're all under. But I think it is important to note that actually some of this work will help with that, because if we are supportive of our staff and we're looking at maximising our opportunity as an employer to really support people to come into our organisation and develop, that will help with some of our recruitment and retention issues. And if we deliver our services differently, and we are thinking more about, some of the wider determinants that result in people presenting at our services, over time we should start to see that having a knock-on effect, because people won't need the services so much because we have supported them to access help with some of their wider issues that they've got going on that are affecting their health and well-being. In terms of the kind of pragmatic next step, we're looking to have a workshop internally over the next month or two to bring together all our internal partners to look at where we're at. There's been a lot of work going on in the background across each of the pillars, and we're keen to bring all that together again and align it very much to the framework that we know is going to be coming out from the Scottish Government. So that'll help us to prioritise and identify if there's particular areas where we think we need to do more. And what we would be really keen to do is to have an opportunity to look at how we do some of that in a joint space with particularly the councils, but also our third sector interfaces and some of our other community planning partners. And I'll stop there and happily take any questions. Thanks, Chair.
Listen, thank you very much. Very comprehensive presentation, and I think it was, from my point of view, quite encouraging to hear about the examples of where you have genuinely informed by best practice in other parts of the public sector. And actually I think there's some lessons that other parts of the public sector, including the council, can take from what you've just outlined. If anyone wishes to ask a question, could you indicate just now? Before I come, I can see that people are starting to come in. Before I do, could I just ask you, from my own point of view, about your approach to the integrated quality impact assessment? So you mentioned that's looking at socioeconomic factors. How do you do that? And just thinking about how it relates to how the council approaches the same issues, but how do you go about that?
Thanks, Chair. So it really depends on what service or areas is being looked at. We have an assessment template, probably quite similar to what the council have, but if we were to take a particular service area, so an example would be diabetes services. That was one that was being recovered as we came out of the pandemic. And what we would look to do is work with that service to look at what data that we either have, through national data sets, or what data they have locally in terms of who's coming through their services, and look at how they're able to look at that data by SIMD and other variables to really understand who's using their service, who's not using their service, what their DNA, their do not attend figures are looking like, and what their maybe drop-offs are, and then look at how they need to reframe or redesign some of their services to better meet the needs of those different groups. So, we certainly know from data across a range of services that, for example, DNAs the trend in DNAs tend to be much higher in people from more deprived areas than people from not deprived areas. So it's how we can look at, is there different approaches that need to be taken with those particular patients if they don't present at a service? Do we need to do more to try and engage them? Does there need to be outreach models? So it's really about working with each service to look at what data they hold, or what data we can access nationally through Public Health Scotland and other sets to better understand. And also, I think critically to the data is also trying to get feedback from their different patient groups. So what consultation have they done? What feedback have they got from examples, things like care opinion, in terms of maybe positive and negative feedback that have come in on their service that allow them then to look at what some of the barriers to access, for example, might be that they might want to address. And one at the moment that comes out a lot from services is around transport, and how we can improve the transport locally, whether it's through community transport or working with some of our transport providers.
Listen, thanks for that. I suppose one of the advantages of being in the health space is actually you have a lot of data. There's a lot of data going about. Okay, I've got 3 questions, and I'm just going to come to each now in turn. So could I come to Maureen Chalmers in the first instance?
Thanks, Chair. Thanks, Elspeth, for that. That was really good to hear the progress that's been made since those meetings with the Health Foundation. I wanted to ask you specifically about the employer aspect, the employer pillar, and some of the work you're doing there around about recruiting the more vulnerable from the more vulnerable groups. I know back then with the Health Foundation and some work with CLES, there was some really good practice round about some of the healthcare trusts in England round about starting with the people, recruiting the people, as opposed to putting a job description out there and hoping folk would apply for it. Is there anything that you have been doing or that you're planning to do in the new strategy that's about taking those kind of very innovative approaches to recruiting people?
Thanks. That's a really good question, and it is something that's certainly come up through the councils, and I'm pretty sure it is South that already do work like that. And I know our team, our HR team, are really keen to learn from those models. So I don't think we've done anything like that to date. I know we have been doing a range of employability programmes, particularly targeting parents, young parents, but I think there's real opportunities for us to learn from what the partners have done around that and build that into our strategy. It is quite a high-level draft strategy that's been developed, and I think there's definitely scope for us to think about, you know, and look at how we can learn from what opportunities there might be around that. So I'll take that back to our HR team and just check whether they have got plans. I know there was certainly interest in it before when it was kind of brought up, I think possibly at one of those workshops. So I'll see whether there has been anything done since then, and if not, I'll ask that they look at that.
Okay, thank you. I'm going to come now to Robert Brown.
Yes, thanks very much, Chair. I wanted to explore a couple of issues. I think it was really quite a comprehensive report. First of all, on the question of co-location, which is talked about it on page 11 of Environment and Assets. Now, obviously, this is quite relevant to transport as well, in terms of where you co-locate. I wonder if there's any flavour in terms of either a list of areas where this has happened or where which is being considered, which will give us a bit of a flavour of what's the potential there. And also, as I say, what, you know, to the extent to which we're managing to actually deal with the transport issue as well. The other thing is on the cost of living thing. You talked about financial well-being being looked at acute centres. Now, I know there's some pilots or arrangements being made at primary health centres where people are coming, you know, and not exactly sitting with a doctor, but being available to, if you like, be diverted and save some GP time. How is it actually operating at acute centres? What's the plan there?
Thanks. So to take the first question, there are examples of co-location, and it's a shame Suman's not here because he would probably be able to give a list of exactly where they are in South, but I certainly know there are examples in North Lanarkshire, and I'm sure in South as well, of where we have had co-located services, and it is very much an ambition for health going forward that we do look at all opportunities to co-locate, and as you say, in terms of transport, that would really make sense, but I couldn't tell you off the top of my head what the plans are around co-location because I'm not involved in some of those planning discussions, but again, we can certainly get that and bring it back to the Commission. In terms of the question around the acute sites, so there are really tests of change going on at the moment within a few areas in acute. We're fortunate that we have a very small team called the Health Promoting Health Service team. We've got one officer based on each of the acute sites, and part of their role is to build that capacity for embedding routine inquiry for financial well-being. So they are working with different areas within each of the sites to try and get the ward staff doing this. I think what they're finding is they are having to almost model some of those behaviours and then look at how they can work with the staff to learn how they can build it in too. They're also in some areas using volunteers too to see what the role of some of our volunteers that work in the hospitals are, who might have a bit more time to spend with patients and have some of that that dialogue with them. But the model very much is about identifying some of the keywords, doing some small tests of change to show the impact, writing them up as case studies, and then looking at how they can expand that. And it is trying to reduce the burden on the staff, because we're acutely aware of how pressured staff are in the hospitals. So it's trying to make sure we're not asking too much of them, that really it is just about raising the issue and referring on. The other thing that is being looked at within the hospitals, and it is quite an early stage, is actually having some kind of information hub in the foyers of the hospital that would be available to both staff and patients on a range of wellbeing issues, including financial wellbeing, that people can just pop into, you know. So that would also then catch carers and family members, or people that were, you know, just popping in for visiting, if they needed support as well. And again, there's just some early models being tested around that across the 3 sites as well.
Thanks for that. I see that Josephine's hand's gone up. Is that in response to... So I'm going to bring in Josephine perhaps to help with Councillor Brown's question, and then I'm going to come to Margaret Walker. So Josephine, if you want to pick that up.
Thank you. I think Elspeth has covered quite a lot of points. Just a couple of minor things to add to what Elspeth has said. So there is the list of co-located services. We can get that, but one small example is around TB service, for example. We have both multidisciplinary teams delivering that service at a acute site. We also have like treatment centers where we monitor, people with chronic or long-term conditions, again at the primary care center. So it's just to give a couple of examples where we can get the full comprehensive list to answer to Mr. Brown's question. Thank you.
Okay, thanks very much for that. Can I come to Margaret Walker now?
Okay, thank you, Chair, and thank you for the report. It was really interesting. It was just a couple of things I was interested in asking in terms of the Public Health Intelligence Hub. I mean, obviously, as you covered earlier, there's a huge amount of information out there, huge amounts of different data sets and equality impact assessments. The issue tends to be sometimes getting the capacity, the staff capacity to actually kind of analyse that and use it, much in the way when you were talking about, services for diabetes. In my experience, that's where the problem is, because sometimes it goes to the people who are already doing the day job. So it's obviously very, very limited in nature when you're talking about driving through, using that information, analysing it, driving through service change, mentoring the staff around service change, consulting with the public. So I suppose my question is, will those resources be available to actually take that forward and harness and streamline all that information? And my other question was in terms of services located nearer to communities. Are there plans to take more services outside the hospitals, for example, like diagnostics or whatever? I know that's been the policy for a long time, but it's not really went at a pace in terms of getting some of these services based in, health services, treatment rooms and things as part of the community. Thank you.
Okay, thanks. There's a few hands coming up now. So can I maybe... Does the one of you or both of you want to pick that up? I think Josephine's going to pick that up. Okay, Josephine.
Thank you. Very well made points there. And I think for the Health Intelligence Hub, yes, there's a lot of data, and we do want to streamline some of the analysis. So we are working with our, both the council partners, and we want to use the resources to kind of focus on what we've understood around the impact of COVID and trying to build on the intelligence. Well, so that's how probably to make best use of the resources we've got just now. But definitely, the more we can collaborate across locally, plus with Public Health Scotland and Glasgow City Region works, so there's loads away in Glasgow Centre for Population Health. So there are a number of partners we want to work with and build on that resource and help us develop that intelligence. In terms of your second point, I suppose the second question around, where we take services locally, yes, there are some examples of that, and making services available to local communities. It's just a balance between what can be delivered at a local level and how do we, again, optimize the sort of resources we have. So diagnostic facilities and these are being looked at, and as we are working through Our Health Together, our healthcare strategy, there's a huge opportunity there again to look at and redesign services to support that approach. Thank you.
Okay, thank you. I have one more question, and it's from Stephen Sweeney.
Thank you, Chair. And I can't believe, Elspeth, this is the first time we've seen each other in person. Lovely to see you as a real human. I wanted to make a point, probably for Elspeth or Josephine, but also for South Lanarkshire Council colleagues. I guess we've now got South Lanarkshire Council's community wealth building strategy, which has been well established, and I know for a good while NHS Lanarkshire have been looking at your responsibilities as an anchor organisation. So my point's probably around about the visibility of quite a lot of good work that's actually been undertaken, and of course there's lots more to do, but there is good work there already undertaken. At the Community Wealth Building Progress Group we had a few weeks back, there was quite a lot of discussion about participation and engagement alongside our communities, which of course fits with our community planning partnership plan and general direction of it. But when, from a third sector point of view, when we're speaking to volunteers or third sector organisations or social enterprise leaders, quite often it comes back around the conversation around about anchors or community wealth building. It's stripped right back to what is it, and how do we actually get involved? So I think a lot of this is fantastic top-down information, but what about the bottom-up bit? I think in terms of engagement with our communities, I don't think there's a wide awareness of what community wealth building actually is, or visibility of some of the really good work already undertaken by the two organisations. So I guess my ask to both is there a natural point in time where there'll be an opportunity at a locality level or pillar by pillar for us to raise awareness around the good work that's already going on and encourage people to get involved? And I guess we just make an offer that, naturally we're keen to make a contribution to this work, our commission as well, so if it would be helpful for that to be facilitated or convened in a non-statutory place, then we'd be happy to offer that. Thanks.
Thanks.
Thanks, Stephen. If I can come back on that, I think that's a really, really good point, and one we're certainly aware of, not only in terms of the wider communities, but even with our own staff. I don't think our own staff really know about it, and it's something we have been talking about quite a lot, is at what point do we start to really think about that wide communication, and it would be helpful to think about how we maybe do that together as a collective across Lanarkshire, because we are all trying to do the same things, and it's maybe just how we frame that in a way that's really easy for people to understand. I think there's examples from other areas, and I think maybe that's going to be touched on in a later agenda item today, that they have been quite visible about what they're looking to do and that kind of shared vision, I suppose, and it's whether that's something we could maybe consider locally, and then absolutely working with yourselves and other partners to get that message out there and trying to make it real for people and in a language that's easy to understand, and crucially get that two-way dialogue with people about what matters to them. So yeah, very happy to pick that up with you. Thanks.
Okay, thanks. And I'm going to just, I suppose, to tie that up, it does lead into our next item. But our head of comms here in the council is in the room, and I saw his ears prick up and when it came to that last item. But I think that the point has just been made that there are areas, there are places that have done this and built a reputation around community wealth building, and actually a lot of the policy changes that they have enacted are policy changes that are now being enacted here and amongst a number of our partners, and we're probably not good enough at distilling it into something that is easily understood, but there's a network of community wealth builders out there, and we have to harness them. I think Sorry, I saw she's reappeared there. I think Maureen Chalmers wants to come in, and I'll take this as the final intervention in this one and then move on. So, Maureen, do you want to come in just now?
Yeah, thanks, Chair. It was just on that very point. I think that Stephen, and it was in my own mind that coming on to the next item in particular, that we need to do more with communities and before we start talking about charters. But I think there are lots of people in our community, in our third sector particularly, who are already doing this work. They don't necessarily brand it this way. And I think we need to kind of get better at having those conversations locally so that we know where that's happening, and we can have those people who are already doing this every day lead on some of this for us, because they're often the best to share that message across communities. So I do think people are out there doing it. I think we just have to, like Stephen says, we need to make this, we need to get out there and do the work.
Okay. Okay. On that point, I think that has been a really useful discussion, and thank you very much, Elspeth, for coming in, and Josephine was assisting there, but thanks very much for the presentation. A lot to consider before we go into the next item. So can I just make sure, sorry, I'm ducking back and forth, so I just want to make sure there's nothing really to agree in terms of that recommendation. So thank you very much. I'll bring that item to a close. Can we come now to item 5, which is on community wealth building and the role of charters, and we're going to ask Neil Reid to speak to this item. Neil.
Thank you, Chair. Members of the Commission may recall the session that we had last year with the Scottish Government, and Neil McEnroy of CLES came along to that. And within that session, the subject of charters came up several times, and the suggestion that charters can be a powerful mechanism for communicating what community wealth building is about, and also building and coordinating efforts around the community wealth building agenda. So it's really following on from that session. What this paper seeks to do is bring you some examples of charters which have been used, and really to give food for thought and sort of pose or provoke the question, would a charter of some sort be appropriate for South Lanarkshire? Would it be useful? And if it would be useful, what form should it take? So that's the purpose of the paper, and section 4 essentially gives you those examples, and it's not intended by any means to be a comprehensive roll call of what's out there. It's really about showing the different types of charters and charter type mechanisms that have been used or are in place, and the focus is really on giving a range of examples. So it starts off with Ayrshire. And Ayrshire's charter, which was put out in October 2020, covers the 5 pillars of community wealth building as we recognise them, and also has a 6th pillar relating to climate action. And you see it's got signatories across a range of public sector organisations in Ayrshire. At 4.2, there's the pillars are listed, and some examples of the pledges that are within the Ayrshire Charter. And I think looking down those, you could see that there's nothing in that we're not really taking forward here in South Lanarkshire as well. So the full charter, the Ayrshire Charter, is attached at Appendix 1 to this report. Moving on to another Scottish area, Fife, they also have a more recent charter. It's actually pretty much the same as the Ayrshire Charter, but it doesn't have the climate action pillar. In a sense, Fife have done it a slightly different way. They've got a charter which has been created as a result of their plan for Fife, but they don't have a community wealth building strategy as such. Instead, they've got their charter, and they're going to develop an action plan off the back of the strategy. So it shows that the charter can come in at different points in your journey and can be used in different ways. Moving again on to another Scottish example, Stirling. They have chosen not to go for all the pillars, and they've got a a charter which focuses on procurement, the progressive procurement of goods and services. And so they have one pledge within that, charter, which is to support Stirling Council's 10-year Thriving Stirling strategy, etc. And then under that pledge, they have a number of specific actions. Again, if you look at those actions, they're not in any sense different from the sorts of things that we are already doing in South Lanarkshire under the procurement pillar. Looking further afield, the Leeds Anchor Network, which draws its membership from over a dozen organisations around the Leeds area, they have developed with the Joseph Rowntree Foundation an anchor assessment tool. And that's essentially the one that Elspeth has been talking about. And although it's not described as a charter, it has very much a similar ethos behind it. It serves a similar function, and it provides a set of principles to guide behaviour and action, and allows organisations to sign up to those principles and assess their progress towards embodying those principles. So you can see their pillars or themes are very similar to those in community wealth building. However, they differ a bit around service delivery and corporate and civic behaviours. So examples from the Leeds framework are shown at Appendix 4. And then also Elspeth mentioned the work that NHS England has been doing to promote the NHS as an anchor organisation. And some of that work is relatively unformed. It's not got a charter backbone, if you like, but there's a lot of tools, a lot of joint work going on, and lots of sharing of good practice. And a recently developed Health Anchors Learning Network has been created to share good practice in that area. Concluding this part as a smaller example, this is the London Borough of Stevenage. And they launched a cooperative and inclusive economy charter in 2020. And it's a very loosely defined charter which really just discusses what is a cooperative and inclusive economy, and then invites organisations, businesses, local people to, via the website, sign up to the charter and pledge their support. And people can go on and indicate the manner in which they want to support this charter. And so it's essentially, and there's examples there at 411 of the sorts of things they suggest people might want to sign up to do. And that's an example of a very inclusive approach which effectively encourages everybody to play their part and suggests that everyone does have a part to play. And this has affinities with those approaches which take the form of a deal between perhaps the local authority and the communities it serves. So Section 5 is a bit of a roundup saying, what do these examples tell us? Well, one of the first things is there isn't a one-size-fits-all. There isn't a perfect charter. Different approaches have been adopted by different localities at different times, depending on their local circumstances. In terms of what the pros or advantages of a charter might be, at 5.6, I guess there's a summary there, and you could see that a charter is maybe less prescriptive and maybe less imposing than having a strategy, because a strategy seems quite a big official thing. So it's potentially more open and inclusive and can invite participation from all manner of organisations and individuals. A charter is clearly adaptable and customisable in terms of what you put in it and whether you have all the pillars or just a few pillars, whether you put in an assessment tool or not. And it's true to say, I think, that it can help raise awareness and provide that locus for discussion around community wealth building, and thereby coordinating support and inviting people's participation. So moving on to the conclusions and recommendations, I think the question really is for the Commission, is a charter something that we might want to have a look at? And if so, what kind of charter might that be? And I think if we were going to say yes, a charter is something we could consider, there's some questions we should really probably bottom out and think through. So some of those are listed at 6.3. So whether, given that we have a strategy and a well-developed action plan, will the Charter add anything? And if so, what is it that it adds? How would the Charter interact with other frameworks and charters that we are already engaged in? Should we cover all the pillars? Should we add a pillar? Should there be, and is the Charter an appropriate mechanism, or do we want to have a self-assessment framework, or both? So the recommendation of the report is essentially that asking for a steer, I think, what you think about this, but also that the progress group, if you think a charter is a good way to go, that the progress group be tasked with looking further into this, evaluating the potential benefits of a charter and bringing their conclusions back to you at a future date. Thank you, Chair.
Okay, thanks for that. Before I come on to questions, I see that Cleland Snedden wants to join us, so I'm just going to pass over to Cleland.
Okay, thanks, Chair. And I'll be reasonably brief, but it does link to the previous discussion. I think if we choose to adopt a charter, then it's going to assist us with raising the profile, raising the awareness amongst our communities and public and other organisations that I think Stephen mentioned earlier. It will act in that regard. My gut feel around this, and if it was my penny's worth, I think that you would be advised to keep this simple. The charter, no matter the format of it, is not a substitute for the strategy and action plan, which is the real guts behind this and actually will drive delivery. And I think it will, however, help us set out the commitments of the partners in relation to community wealth building that will help that understanding. So I would suggest keep it simple. Don't add additional pillars. Don't have multiple charters. It will just be confusing. Have a single charter, sets out our commitments across the 5 pillars, and it will act as a beacon. But the real engine room behind community wealth building is your strategy and the action plan that goes along with it. Thanks, Chair.
Okay, thanks for that. I'm going to open up, I'll maybe give my own reflections first and then open it up for contributions. But I think, so this was one of the takeaways from the session we had with CLES, and I think whatever we do, we want to make sure that we are following best practice, because there's now there is much more work going into understanding what best practice is and sharing it across the public sector. I agree that we have to keep this simple. And if we do want to go down the road of a charter, and incidentally, I think we do want to go down the route of having some kind of charter, we need to just reflecting on some of those discussions we've just had. We don't want to complicate work for our partners who might have a different approach from other partners. So the council's gone down a particular route. We've heard about the NHS approaching this in a different way, but for the same ends. And I think that's the crucial point for me. And also I do think if we look at the attempts to roll out what is a community wealth building approach across different parts of the public sector, across the city region, and to promote it more generally, then I think that almost the joint statement of intent is useful. I think it would be useful, incidentally, to be able to have some form of evidencing how decisions are changing and how spending is changing and how the complexion of local economies changes on the back of it. But that's an area where I think the council is still trying to establish how to undertake that. And I actually think the charter helps you with community engagement, because I think it can set out in very simple terms what you are trying to do, and it gives the community that assurance that you're trying to mobilise different anchor institutions, and indeed institutions that might not think of themselves as anchor institutions but nonetheless direct a huge amount of spending into the same kind of place. It gets you that kind of alignment where we're in the same kind of place and share the same kind of objectives. So the recommendations in the report really are the way the progress group is tasked with evaluating the potential benefits of a charter, and that any report is brought back. And I don't propose that we change that, but I do think it would be useful to get a steer from the Commission today to say that a charter is the route through which we want to progress, and that we progress it in the way that is set out in the recommendations in the report. That is my view of it. I've got a couple of contributions to take, and I will start with Margaret Walker.
Thanks, Chair. You've just made half my points. I think it would be a really useful tool in terms of consultation with the communities. I mean, you're not going to go out and go through the whole strategy and an action plan, but this encapsulates the principles and it's a good starting point to talk to local groups. It's also a useful tool for putting out there on the website or Facebook, even social media. So, plus everything you've said yourself already, Chair, and the Chief Exec. So it would certainly be my view that we would adopt this. I, as a councillor, an elected member, would find it a really useful tool in terms of trying to, communicate and get it out in the community what it's all about in terms of community wealth building. Thank you.
Okay, thank you very much. I'm going to come now to Maureen Chalmers.
Thanks, Chair. I'm a wee bit confused now because I thought the recommendations were that we asked the progress group to evaluate the potential benefits of developing a charter. I'm not sure whether it's the right approach or not, and I think the questions set out in the paper are appropriate, but I'm really quite concerned that folks seem to be steering it in a particular way without exploring that properly. I'm not actually sure whether it be helpful in community engagement or not. I think we still need to do some solid work in the community so people get that in-depth understanding of what it means to them. I'm not sure a charter will do that. It's a different thing, I think. So, but I think my main thing is that I would want this work to be taken forward and evaluated properly without folk telling us that we're going to have one anyway. I'm a wee bit worried about that. Thanks.
Thanks. Just to clarify for Maureen's benefit, the recommendations as set out in the paper are the recommendations that Maureen's just referred to. What I'm suggesting to the Commission is that if they are looking for a steer, I think we should give them a steer today, and I think the steer should be that they aim to bring forward a charter. So that is something I'm proposing by way of discussion or potentially as an additional recommendation, but I'm happy to take the soundings from the group today. One way or another, that the work is set out in the report is going to have to take place. Can I come to Kirsten Robb?
Hi there. Happy to support the recommendations to explore the work. I can see the advantages of a charter in terms of communication, but also picking up on Maureen's point about real groups being able to sign up to say we're doing this already. That's a good sort of helping people realise that they're kind of equal partners and we've all got a role to play in community wealth building. Just on the climate pillar, I think what might be useful is obviously to keep it simple, but maybe just to have a wee look at why Ayrshire added a second or that sixth pillar, and just a wee check against it against what we're doing, and just to see if there's anything that they've picked up in that climate pillar that could maybe be integrated into the other 5 pillars. So not asking for another pillar, but just as a wee check of the existing strategy to see if there's anything useful in the Ayrshire one that could be picked up. Thank you.
Okay, thanks for that. And I think that's something we can pick that up and go into the progress group, etc. Okay, and I'm going to come now to Josephine.
Thank you, Chair. So I think many comments have been made, and I think we support the exploring the use of charter, because I also feel that it will help us with the engagement. And but one question or request would be: can we look at it on a wide Lanarkshire-wide basis? Could we use it? Take a partnership approach there, which then helps us as we develop as anchor institutions across the board. And I also support the suggestion about looking at the climate change. I do think we should limit it to the 5 pillars, just again for clarity, but see whether within the pillars we are able to absorb that sustainability work as well. So thank you.
Okay, thanks for that. I think we can note that. Can I just ask, when you say Lanarkshire wide, you mean coterminous with the sort of NHS Lanarkshire, you mean North and South Lanarkshire? I think there's probably a bit of work to be done on that to look at where North Lanarkshire are with community wealth building as compared to others, and what do they call it, and how do they refer to it? But we'll pick that up. And can I come to Margaret Cooper?
Thank you, Chair. I second your recommendation that we move towards the development of this charter. Some of the points that have been made will actually be entrenched in the work towards writing the charter, the exploration of other examples that have been done previously. I'm quite happy to support that we move forward on that basis.
Okay, thanks for that. It's not in my, given the nature of the Community Wealth Building Commission, it's not a council committee, so it's not particularly in my nature to push any sort of items to votes. So can I suggest that what we do, if it is all right, the recommendations that are set out in the report are as set out in the report, which is that we note the contents of the report, that the progress group's tasked with evaluating the potential benefits of developing a charter for South Lanarkshire, and then that a report comes back to a future meeting. Now, I think the progress group and our officials are looking for a bit of a steer today as to what that would entail. Although I have every confidence that they can dispassionately put forward the different options in a future report and have those discussions later. But part of what they are going to do is be thinking about what would a potential South Lanarkshire charter look like anyway. See, rather than push this to a vote, I think they will probably note the strong preference of some of us, and they'll also note the concerns that have been expressed. And given that there's some follow-up questions that have been raised, can I suggest we just agree the report as is? But I would just say to everyone in the Commission that, and I obviously wear several hats in chairing this Commission, my very strong preference is that we get South Lanarkshire as a whole, not South Lanarkshire Council, South Lanarkshire as a whole, into a position where we have some kind of charter that actually aligns us as much as we can, not in the detail, but on the outcomes that we're seeking to achieve with those other parts of the public sector, those other anchor institutions, and there might be other anchor institutions that we haven't considered fully up to this point, so that we can take forward an agenda that is actually about trying to change the shape of the local economy. And I think the charter, to pick up Margaret Walker's point, and Margaret Cooper's come in support as well, I think it actually helps focus minds on what we're trying to achieve, and it helps us communicate to South Lanarkshire what we are trying to achieve. And in that sense, I think it's quite useful. And the other point, the final point I'll make on this, is that we should actually look at those areas like North Ayrshire and Preston that have built a reputation for community wealth building, and look at how they communicated what they were about to their communities, and how their communities actually helped shape what those local authorities were doing. So I think instead of pushing for a vote on an additional recommendation, I'll maybe just suggest that our officials have listened to the discussion and will be able to take on board the points in favour and the concerns that have been expressed, and coming forward. But people know what my view is very clearly on the item. Can we then agree the recommendations as they are? Agreed? Okay. Can I come now to item 6, which is on the area profiling tool? And Neil, I'm going to come back to yourself.
Thank you, Chair. We have brought statistical information on the social and economic situation in South Lanarkshire to the Commission on a number of occasions to serve as context setting for our work. That's been in the form of a data digest that we've brought to you in 2021 and in 2022. We will bring another update to that publication later this year. But at previous meetings of the Commission, there has been an interest expressed in whether some of this data can be analysed at a lower geographical level. And so the purpose of this paper really is to signpost for you a tool that is available on the South Lanarkshire Council website, which allows you to do some statistical analysis at a small geographical level. So we call it the area profiling tool. It's not a new tool, we've had it for quite some time, but recently, to use an old Scottish term, we've given it a good read out. So we've taken out some old indicators and some less suitable indicators, but we've also aligned the topics that you can get statistics on with the outcomes in the council plan. So it ties in much more clearly than before with our strategic objectives as a council. So essentially the tool has two main features, and I'll just very quickly run through what you can do. You can select a geography that is of interest to you. And the tool is built, the geographies are built up from data zones. So there are 431 data zones in South Lanarkshire, and they're designed so they've got between 500 and 1,000 residents. So some of those data zones are quite large geographically because of the sparse population, but some of them are very small. But you can choose a single data zone, you can choose a dozen data zones, and you can define your own area. And once you have done that, you can then run statistics about that area. The tool includes a number of predefined geographies, so rather than you having to select all the data zones that, say, make up a particular ward, you can go in and say, I'm interested in wards, and it will give you a list of them. You choose one, and then you can get your statistics about that ward. So once you've selected your area, as I say, you can choose what it is you want to inquire about, and the topics listed there at 4.5, they're the same ones that are in our council plan, or you can choose to run a report against all of them, and that's what Appendix 1 shows. So it shows the output from the system if you choose the Hamilton Area Committee as your geography of interest and you ask for all of these statistics. So it gives you an idea of what's in there. The data underlying the profiles is updated as soon as new data is published. So although there is data lag in there, so for example, you will see the 2011 census is referenced, and that's because for some statistics, that's the most recent we've got. But as soon as new information is available, it gets put into the system. So it's available for anyone to use, it's available for communities to use, it's available for you to use. As I say, it's not a new piece of technology. We will be moving it on to more modern technology as it becomes available. And as we do that, I think we're hoping to develop dashboard-style presentations. And within that, although currently this is a range of statistics covering a wide range of topics, I think we would like to see potentially a community wealth building dashboard, which might take a selection of these statistics and any others that we can get down to a low level to include within this, so that we will see the development of a community wealth building dashboard. So essentially it's really to make you aware of that tool. I hope you find the time to go in and have a play around with it. I hope you find it useful, and recommendations are to note the contents of this report. Thanks.
Okay, thanks for that presentation. Can I ask if there are any questions? I will come to Kirsten Robb.
Looks great, thanks very much. It was just to ask if a link to the tool could be sent round to members, and maybe a easy link where to find it on the website would be great. Just as an aside, I was looking through the stats, and with move to 20-minute neighbourhoods, I noticed that, I don't know if it's the Scottish Government the stats don't measure how long it takes to walk to local facilities. It's only by car or public transport. So that was just something I noted that I can maybe ask where the data comes from that would measure that. How are we going to assess if we're moving towards 20-minute neighbourhoods if we don't measure it? Maybe it's being measured somewhere, but I just don't know. But that'd be great. Looks good. Thank you.
Okay, thanks for that. I'm not seeing anyone coming in to answer that point. I suspect that perhaps community and enterprise is where we'll be able to get a more informed response to that one. So I think we'll probably try to see if we can find an answer and circulate that one after the meeting. Okay, Josephine.
Thank you, Chair. Thank you. This very impressive development. Was aware of what had been available before, so very well thought through. So thank you for that. Just a couple of comments really around the statistical theme, whether we've considered having older people as a group, just in terms of the demographic changes and challenges. That might be something would be very helpful and interesting to look at. And also, I suppose from the reports, I haven't been on this, I think you can customize reports, so whether it's also by trends, these reports will be available, and so that we can see that kind of tracking, the monitoring, and very interested about the dashboard. So it kind of links very well with the intelligence hub we want to look at. And one of the things we want to explore, I suppose, is that kind of targeting. So if you overlay different pieces of data, how we can target some of the work we need to maybe do in particular communities. So it's really, I think great functionality, and it would be really helpful to explore what can be done together and add more and get the intelligence we all want. So thank you very much.
Alec.
Yeah, whenever I see data zones, I'm left with a feeling that I'm underwhelmed by them. They're great if you have a very similar community. And although you have a great in-depth amount of information here, Neil, when you go out into the rural area, there's a much broader mix of different groups of people, I'll call it. And I don't believe that data zones based on a geographic area actually contribute as much as what they could do in the rural area, because it tends to hide and minimise some of the groups that need help most. Is there no way that, 20 years ago, I used to see at the bottom of every council paper an account will be taken of the rural area. I almost feel that one of the points, your final points here, the urban, rural, can't remember what word you used now there, I read it, divide, I feel it's almost going back to that. It's not fully addressing what's happening in the rural area, and I'm wondering if there's not a better way of being able to identify who needs help and basically where they are.
Pressing too many things. Yeah. I think it's important that point is made, that we don't always have the best intelligence about rural areas, but the data zones, it's a very sort of common parlance that we use for analysis, and a lot of work has been done on that. I think when the census is available to us, then that will give us, I think, a new insight into the characteristics of the rural area as well as urban areas. And I know that all council services pour over the statistics we get from that. And so I would hope that we're able to take account of the rural area sufficiently in our deliberations, informed by that data. But there certainly are shortcomings in what we can know about some rural areas.
Okay, can I come to Margaret Walker?
Thanks, Chair. No, it's just to say thanks very much for this. I knew it was there, but I wasn't sure how up to date it was the figures and the information was, because it's a really useful tool in terms of getting an overall view in terms of your own area, your own ward. But I was going to ask, in terms of the data zones within a ward, there's huge differences in terms of SIMD stats and areas within my ward. I take it that it goes into separate data zones. It wouldn't just go into sort of, Ward 13 overall. You would get all the different areas, drilling down to that level.
Well, if you choose your ward, you will get the statistics about the ward as a whole. But no, it wouldn't automatically give you the statistics about each of the data zones within that ward. But it shows you what your ward is. You can go and then choose those data zones.
Right.
You could always contact us if you wanted that full, so many pages of data. Then we can supply that for you. But the tool itself won't give you because if you chose the whole of South Lanarkshire, if it then went on and gave you every data zone after that, it would be quite a substantial amount of stuff. So I think but you can go in and choose the data zones that are of interest to you, and so you can select the more deprived data zones if you know where they are.
Okay, and I could ask you for that?
Yes, of course.
Right.
Yeah.
Great, thank you.
Thanks, folks. I'm not seeing any more questions, so can I just ask us to agree that item, or to note that report? And can we move now to item 7, which is the community wealth building, and it is a response to the Scottish Government's consultation, and can I ask Tom Little to speak to that item?
Thanks, Chair. Yep. I think this is quite a straightforward report, and it brings before the Commission details of the consultation on community wealth building that was launched by the Scottish Government on the 31st of January. Now, it wasn't a surprise. It had been trailed in the programme for government for 22-23, and the aim is to seek views on what is required to accelerate, as they describe it, and deepen community wealth building in Scotland. So what this report does is it outlines the consultation document and the questions that are contained within it, and proposes a route for us to issue a joint response on behalf of the Commission. So the consultation paper has 3 parts. Part 1 sets out the background to community wealth building, and Part 3 gives details on how to respond to the consultation. So that leaves the meat in the middle of the sandwich of Part 2, which sets out the proposals for a duty to advance community wealth building, and it goes on to explore each of the 5 pillars in turn, looking at what specifically legal changes may be required to advance community wealth building further in Scotland. So the report you've got before you today picks up the detail of that Part 2 from 4.5 in the report, and on the key question of a duty to advance community wealth building, the consultation paper offers a number of options, and they're set out in the bullet points for you there at 4.5. Beyond those options, respondents are being asked for their views on which bodies might be covered by the proposals, and some key, perhaps look like more minor questions, but key questions we think in terms of how we ensure the involvement of local communities, businesses and the third sector in the implementation of that duty as it comes forward. So the consultation goes on to explore how each of the 5 pillars might be advanced by any changes in the law. And this is done in some detail by using examples of suggestions that have been gathered and which have come from stakeholders in the course of engagement on community wealth building thus far. And these are spelled out for you at Table 1, it's 411 in the report, and you'll see them listed under the pillars spending, workforce, land and property, inclusive ownership and finance. So, I mean, the point here is we knew the consultation was coming. I think some of us underestimated just how detailed the consultation might be. So I think we need to be cognizant. This is a big deal. It's a wide-ranging consultation, and it could have significant implications for public sector partners and indeed our whole community going forward. So in terms of next steps, we have a timing issue here somewhat, because the closing date for responses to the consultation is 25th of April this year. Now that obviously is before the next meeting of the Commission. So what we're proposing is that we give this to the Progress Group to develop a draft response, and that draft response is then circulated around members of the Commission. And then we're hoping you'll allow us to have it signed off finally by the Chair of the Commission so we can get it in on time, and then we'll bring a full version, the final submission, to formally table it at the next meeting of the Commission in June of this year. That's essentially the recommendations, is that we follow that timetable and get this consultation responded to in time. Thanks.
Okay, thanks for that presentation, Tom. So I'm not seeing any hands or anything coming up at this point. So given what Tom has outlined, can I just ask that we agree the recommendations in the report? Agreed. Okay, it brings us to our final item, which is just about the meeting timetable for future meetings. That's, let me think. So it's item 8. I would just ask if people are content just that we note the forward programme. If we're happy to do that. And then the final item, unless that is because there is another item on the forward programme for future meetings. Yes, and I'm going to ask Tom Little to speak to item 9.
Thanks, Chair. Very straightforward. This just lists the papers we have scheduled to currently come before the next Commission, the one after, and a kind of longer term range of options thereafter. You'll see the schedule we have for the next Commission in June is already quite a hefty one, a good agenda there, and is to be noted. Thank you.
Thanks for that. So I've got this the wrong way around, apologies. So can we note item 9, which is the update that Tom's just given us? If I can bring you back to item 8, we're actually just going to have to formally, for the minute, approve and agree those dates. So I can ask that we agree the dates that are set out in item 8. We agreed. We're agreed. Fine. On that basis, I now come to a point where I have no other items of business and no items of urgent business. So I'll bring the meeting to a close and thank everybody for attending. Thank you.